Hello, everybody. My name is Christopher Altwaiter, and I am at Walden University, and I'm here to talk to you guys about the drug abuse in Carroll County, Maryland. Our overview today will include identifying the population group at risk within Carroll County versus Maryland, identifying the gaps within care to provide social determinants against drug abuse, the opinion of the community regarding drug abuse within Carroll County, both primary and secondary prevention at Carroll County available, nursing interventions within Carroll County for current drug users, culturally competent assessment and intervention by the community, evaluation of outcomes, both long-term and short-term interventions, feedback from healthcare professionals within the community, and personal role of promoting positive social change as a healthcare leader. So some of the statistics are from the Census of Carroll County Community in 2015. Carroll County currently has 167,627 members. Of that, I believe, looking at my notes, 92.6% of that population is Caucasian, which is in my little presentation here, the light green portion of the pie graph. The rest of the population is the dark green portion of the pie graph, which separates into that little bar graph on the side, which concludes the rest of the 7.4%. African Americans depict 3.6%, which is the orange. Asian Americans are 1.8%, which is the red portion. 1.8% is 3.2% is the Hispanic green. And combined races is the light green, which depicts 1.7%. And our smallest percentage is 0.2% for the American Indian / Alaskan Native. My next slide here depicts the statistics between Carroll County and Maryland regarding their heroin and prescribed opioid deaths. The statistics here show the correlation of deaths in the past 9 years in Carroll County compared to Maryland, both with the use of heroin and prescribed opioid counterparts. To note is the past 3 years, from 2012 to 2015, the large increase in deaths from both heroin and prescribed opioids has increased by almost 50% in that year. To note also is the just steady trend within Maryland throughout the whole 9-year period in regards to the prescribed opioid use, which is anywhere between 250 and 350 deaths per year. My next slide here is the gaps of care within Carroll County regarding drug use and drug abuse. Carroll County is currently plagued with drug abuse in the form of heroin and cocaine, as well as prescribed medications, opioids such as fentanyl, and that is due to the very limited combination of unmet needs and unmet demand for proper treatment. Lack of education and awareness include the outreach to the general population from our children, adults, and geriatric population. This gap is especially important as it would prevent further outbreak down the line by cutting the trend at an early age, as long as we reach out to the children first. The lack of resources include outreach programs such as methadone clinics or detoxification clinics, rehabilitation centers, and general support groups that addicts would need or would like to receive. Our lack of treatment options is kind of a vague term, so to say. However, it's just as important. Treatment is very limited to the addicted. And although we offer inpatient care within hospitals and psychiatric facilities are able to provide care to the addicted, it does not provide enough long-term support care to the population. The next slide here is opinion of community regarding drug abuse and drug addiction. So I went about and spoke to just the local community in passing at the mall, at the community college, at shopping centers, just regarding their opinions of what drug abuse means to them and what we can do for them. Now, in sense of children, I've always spoken to children with their parents in mind, and we generally had a very good sense of right and wrong And although they may imitate the parent at times in terms of drug abuse and drug use, most will stay away from drugs and illicit substances. The few opinions I received were always in the positive of note, in the aspect of to stay away from drugs and to say no to them. Now, the teen population, I received some mixed reviews regarding drug use depending on the surroundings and their peers. I would get situational responses such as get high every day and stay away from drugs and say no to peer pressure. However, the drug opinion, the opinion of the drug addicted tend to stay positive, stating that they would like to see the addicted get more help. Young adults in our community within the colleges again had very mixed results, saying that they have experience with some drugs while in college and even use marijuana from time to time, but trend away from more serious illicit drugs such as cocaine and heroin. However, the opinion of the drug addicted trended negatively, stating that those who partake with drugs, state that they're doing it to themselves and that they should get themselves the help they need without any further assistance. Adults within the community, lost my slide. The adults within the community again gave very mixed results, saying that they have experience with drugs in college and even partake from marijuana from time to time when it was socially accepted back in the 70s, but that they currently do not partake with any kind of drugs of that sort. Their response to drug abuse and addiction trended positively, stating that they would like to see more assistance given to those who need it, but understand that the community and the city has only limited amount of funds and that drug abuse probably isn't on the top priority list. Finally, the geriatric community shared very similar responses in that aspect, except that they would like to see the drug abusers and drug addicted help themselves more rather than the government having to step in and provide the assistance they need. My next slide is public interventions and preventions. So we have primary and secondary interventions and preventions. Primary prevention aims to prevent disease or injury before it occurs. So for primary prevention, we have programs such as DARE, Drug Awareness Resistance Programs, that reaches out to the children from 3rd grade to 8th grade, explaining about the dangers of not smoking and drinking, but also bullying and other drug use and risks and dangers. Hospitals and community centers provide educational awareness programs annually at Carroll Community College and at Carroll Hospital Center, and biannually at the Westminster City Hall. Again, the risks of the drugs and its negative effects are announced, and attendees are encouraged to promote healthy habits. Public awareness announcements via newspapers, news stations, and other social media news usually come only after there was an overdose death within the community, and only when it was permitted via the family to consent to provide that education and outreach, to provide awareness and to make sure that those who are currently seeking support and help can receive it and where to find it. Lastly, our primary prevention centers include AA and DA programs, which is Alcoholics Anonymous and Drug Anonymous, and they offer support groups both within the hospital systems as well as in the local churches, who provide individuals who have done and completed their rehabilitation centers and are now in the community seeking additional assistance. Secondary preventions aim to reduce the impact of disease or injury that has already occurred. So those are the mostly inpatient hospital clinics such as Carroll Hospital Center and Shady Grove Medical Center, which both have inpatient and outpatient centers for the drug addicted. We also have currently 2 methadone clinics, which are also detoxification clinics that the addicted can go to receive care. Continued as nursing interventions. So primary interventions continued would be school nurses can provide education to school-aged children to help provide and prevent them from using illicit drugs of any sort. Public health nurses can do the same, only at a public health facility such as the Department of Health. Community outreach programs that can provide additional preventative measures to prevent the public from using drugs. Attending AA and DA meetings can become, nurses who do that can become sponsors to those who are currently struggling with addiction, so that those who are addicted can get better. And finally, providing continued education to our emergency medical support staff and first responders, so that they know when and how to use Narcan to those who are addicted to reverse those types of negative effects. Nurses can also provide secondary interventions. Our emergency department and floor nurses all are secondary preventative interventions, simply by assessing our patients, making sure that those who are seeking help, or even if they're not seeking help actively but are looking like they could use assistance in that aspect, can get that further assistance down the line. Our psychiatric unit nurses work as a secondary intervention prevention nurses by providing continuous care, as well as the nurses and staff that work in outpatient methadone clinics. Our next slide is culturally competent assessment. Providing culturally competent care is important, so some of the things we want to avoid is stereotyping, prejudice, racism, ethnocentrism, cultural imposition, cultural conflict, and culture shock. If you require what that means, let me know, and I can tell you specifically which means what in that aspect. Things that we do, however, want to promote is culturally competent care, which includes cultural preservation, accommodation, repatterning, brokering, and relativism. Some of the short-term and long-term goals and my evaluation of them include short-term goals, more community awareness, which is a very feasible goal, as it can be reached via a group of individuals. Local outreach can be brought to the community via City Hall having more than just their annual awareness meeting. The hospitals, such as Carroll Hospital Center and Shady Grove, as well as the community college and McDaniel College, can have more than just their annual meetings, and probably could provide more than just the annual meetings. These meetings can be promoted again at local churches, libraries, town centers, shopping districts, even within restaurants. The location can't be promoted enough everywhere. This can educate the public on the harmful effects drugs have long-term on the human body and the dangers that they can create. The community as a whole can provide an outreach and caring to those who are suffering from addiction and attempt to provide assistance to its addicted by offering jobs and housing to those suffering from addiction. Some of the long-term goals include healthcare facilities around the state and nation can come together and stop discharging patients who are known for their IV drug abuse, and perhaps start initiating counsel to those who suffer from addiction right then and there. The rationale behind that kind of is that we don't discharge a patient who has, COPD, CHF, just because their symptoms are treated. We discharge once we know that they are safe within the community. So why do we do that with IV drug abusers that we know, hey, they're abusing drugs, but we're not doing anything long-term for them? We could also do something very similar to the pull and smoke out scenario, which could help prevent and stop the spread of drugs by holding not only ourselves but those around us accountable to not do illicit drugs. We could then do the annual celebration of the Free Day, where we can come together and celebrate the accomplishment of being drug-free for the year. I would like to receive some comments, not just from the children and those I met in the community, but also from our healthcare professionals who I'm presenting this today. So if you could give me some feedback, I would highly appreciate it. And lastly, my personal role as a healthcare leader, and as a nurse in general, providing public awareness and education is key to providing success to the community and to help decrease the use of illicit drugs, but also prevent further deaths from drug overdoses. I plan to be more active in my community by going to City Hall to petition for more awareness among the community. I plan to participate more with the outreach programs within the Department of Health. I would like to go see the AA and DA meetings to get more clear firsthand what is happening in the front line and what kind of assistance drug addicts would like to see, so I could see what more could be done. And lastly, as a nurse leader, I would like to promote more awareness to the surrounding colleges within Carroll County, such as McDaniel and Carroll Community College, to educate the youth about the dangers of drug use. I have also included a small video which has a father telling his son that his mother has passed due to a heroin overdose. You could watch it to kind of see how it truly affects the public on a daily basis. And then my last slide is just my reference page. Thank you very much.